coronary calcium scoring is an imaging technique. It's a type of heart scan, and it actually can be done in a matter of just a few minutes. What it does is it creates pictures, which are very thin slices through the arteries of the heart that can develop calcification or plaque, the process that we call atherosclerosis that can predispose us to getting heart attacks. Heart disease is the #1 killer in the United States still, unfortunately. The American Heart Association statistics tell us that if you take a person who's age 50 and you look at their lifetime risk of developing cardiovascular disease, it's 1 out of 2 for women and 2 out of 3 for men. But unfortunately, 2/3 of the time, people have no warning symptoms, and the first event is either a heart attack or, in very tragic circumstances, it's sudden cardiac death. The people that should consider having this test done would be if people have significant risk factors. What are the risk factors? The most significant risk factors are a positive family history. That's if a primary relative, mother, father, sister, brother, had a heart attack or a coronary event of some sort, heart disease identified early in their life, like 50s or 60s. Diabetes is another big and significant risk factor. The other ones are high blood pressure, smoking history, having high cholesterol or some other lipid abnormalities that sometimes are also genetic, obesity, and sometimes inflammation in the arteries that can be associated with other inflammatory conditions. But in asymptomatic people, it's better than actually a regular treadmill stress test. Basically, you just lie under a scanner. It's a big open scanner. It's like a big open donut, and they lie there for a couple minutes, and literally the scan can be done in a matter of 1 minute, or even in some cases 1 breath hold or 1 heartbeat. And it quickly will scan through the arteries of the heart, generates these beautiful pictures that are nice thin slices through these arteries, and that's all that the patient has to do. The rest the computer does, and the physician is interpreting the scan. It tells us where the plaque is present, how much plaque is there, if they have more plaque than the average person their age, and that has a lot of the prognostic capabilities that we talked about. If there is a significant amount of plaque, then that usually kind of determines whether somebody should have other testing that's more involved. That would be like a treadmill test, or a treadmill test combined with some other kind of imaging, like a nuclear scan or a echocardiogram. In some cases, this test can be done, another version of the test is with a little IV in, that there's a minimum amount of dye, and it's sort of like a non-invasive angiogram. But this test involves no intravenous medications or contrast or dye. It's simply just lie there, take a deep breath, and it's a quick picture of your heart, just like it's a quick picture of your face.